first of all, I believe that data related to healthcare, we have never forget that the owner is the patient. So we should allow the patient to share the data when they want and not when they don't. But don't lose our mind with messing up with this. I mean, the
Even on
own.
these times, even now, where
Well,
patients could be, could be like contaminating other people and passing the disease. Even now, do they have I'm just being like the Evil's lawyer here, and like trying to give a different perspective. On China, they just trace it and they don't
uh,
give an option now. Like,
that's an ethical problem, not a technical problem. So I don't have an opinion on that because that's a problem that politicians should do what they think they should. On my own opinion, we shouldn't step on that way. I don't think it's a good path to follow. We have many options before that. Many. I mean, people is willing to share how they feel, and they are doing it in a massive way in many countries, and we are seeing that. You don't have to apply anyone to give the information. People is willing to do it, so we don't have to force it, I think. I don't know,
Yeah,
Eduardo, your opinion on that.
for me, we are seeing a lot of initiatives regarding digital contact tracing. And for example, in Taiwan, they did it, I think, and they only allow it to be done in specific emergencies, such as what we have right now. In Singapore, they did it as well. So they have this data, these devices, applications that use low energy Bluetooth in order to connect with each other, and they're using it to trace contact. So contact tracing has been for public health the the normal practice. So contact tracing is a thing that happens with any transmissible disease. So and contact tracing happens when you report your own contacts. So once again, this is a case for usefulness. If we're able to identify our own proximity contacts, we can, of course, allow by self-reporting health authorities to map who our contacts are when we turn positive for coronavirus. And maybe that's enough. Maybe that's just what we need. And allow me to say this, because in several countries you don't have a systematic way of doing this with self-reporting, or at least you don't have a unified way of doing this. You have
yep.
several fragmented approach, as we have in Portugal, but those fragmented approach are not reporting to the health authorities right now. So that's of course also a danger. And once we can establish, okay, this is not enough for us to regain the power of our economy, then we should move into contact tracing. And contact tracing, and we have standards like the Pan-European Preserving Proximity Tracing that allows, of course, within what's possible technologically, privacy preserving anonymity for
Yep.
digital contact tracing. And that may be helpful, but today there is not sufficiently strong evidence to say that digital contact tracing changes how the disease transmission changes throughout the time. So we don't have enough evidence today in order for us to do an all-in approach in digital contact tracing.
And can I just add something there?
Yeah,
Because that is exactly what is the main argument and why we should not do it, is because first of all, you don't have the clinical evidence that it will actually make a difference, and that should be one of the main arguments from coming from the general public. I mean, we also here to both, like, we are the ones trying to build new technology that takes new measures into effect, and we're trying to change things, we're trying to do things, but we also need to be very responsible in those things, and we know how the technology works, and we're facing a lot of people that have no idea how it works. So we should also be the ones, trying to actually say what are we up against. And as you said, Christian, there are many things we can do before the tracing comes into effect. And as a fairly civilized European Union, we should try to do those things before. And we have a lot to win. Also, there is a lot of how you say, experiments being done in terms of that we don't know. And we can also experiment a lot before we go into this. And I mean, there are still very good ways of communicating to the general public that I think works. So I think the responsibility of the politicians is to speak to my behavior and convince me to do these things and keep the distance, wash my hands, do all of these things before they do any other things. I mean, so I really think this is, for me, the last resort, and I don't hope we go to an area where we would actually see this, because what I'm worried about is will this be an excuse to test out these kind of things? Is this now where we can say, well, we know it works, we've seen it in Taiwan? Because that's also what you hear some voices saying. In Taiwan they do it, in China they do it, and as you said,
Yep.
say it works, right? Is that then we should do it? And then it's also being like, well, we're not sure it works, so then we shouldn't do it. And for me, I will be against that we should do many other things before, and also don't think it's not worth whatever we're up against to actually do those things.